My name is Elaine Situ-LaCasse, and I'm an assistant professor of emergency medicine at the University of Arizona College of Medicine, Tucson, and Banner University Medical Center, Tucson, in Tucson, Arizona. My project is titled Ultrasound Novices Comfort Level in Performing Ultrasound-Guided Procedures After One-Day Hands-On Training Session. I'd like to note that this research was made possible by funding from the National Foundation of Emergency Medicine Scholars and Mentors program. Central venous catheter placement, thoracentesis, and paracentesis are commonly performed procedures in the emergency department and inpatient wards. However, due to the invasive nature of these procedures, there are limited opportunities for novices to practice on live patients. Multiple studies have shown that ultrasound guidance during these procedures are safer than the landmark-based approach. Ultrasound guidance for central venous catheter placement is considered standard of care. Previous studies have investigated users' ability to learn these procedures based on landmarks, but none have investigated novices' comfort levels after a training session teaching ultrasound guidance for these procedures. So our objective is to evaluate ultrasound novices' comfort levels in performing these procedures under ultrasound guidance after a one-day hands-on training session. This was a prospective study at an academic center. Study participants were third-year medical students with minimal ultrasound experience. Point-of-care ultrasound faculty members taught the students ultrasound-guided needle placement, thoracentesis, and paracentesis on simulated models during this one-day event. Prior to the training session, they were given a pre-session survey along with a 1-hour intro lecture. After the hands-on training session, students completed a post-session survey. Descriptive statistics were used to summarize the data. Survey responses were reported as percentages of total respondents with 95% confidence intervals. In this image, the medical student is learning how to perform needle guidance under ultrasound on these simulated models. These models are filled with synthetic gel and vessel loops to mimic vessels. We are teaching him the in-plane approach, or the long axis approach, so he can visualize the needle tip under ultrasound the entire time, which maximizes patient safety. The thoracentesis model was a pork rack of ribs, and this lends itself very well to ultrasound and to simulating the human body. You can see here there are 2 ribs under ultrasound, and this hyperechoic line is the pleura. And the 3 arrows are pointing out the needle that is being visualized in real time in the in-plane approach. The paracentesis model was created by placing a piece of pork belly over a jug of water. Inside this jug, we place surgical towels to mimic the bowel. In this ultrasound image, this anechoic area is the fluid, mimicking ascites. This hyperechoic area here is mimicking the bowel. Here you can see the needle being pointed out by the 3 arrows of the in-plane approach. A total of 114 students completed the pre-session survey, and 113 students completed the post-session survey. In the pre-session survey, we asked how many students performed the procedure under real-time ultrasound guidance, and the breakdown shows that paracentesis was the highest in terms of how many students performed this under ultrasound guidance at 6%. Then it was central venous catheter at 3.5%. Lastly, thoracentesis at 2.6%. Over 80% of students reported having low comfort level based on a scale of 1 to 10, 10 being highest comfort level, in performing each of the procedures on the pre-session survey. After the one-day training event, the medical students felt much more comfortable with each of these procedures. 66% stated they were more comfortable with a central venous catheter placement, 72.6% for the thoracentesis, and 75% for paracentesis. Majority of the students agreed that the hands-on practice of these procedures under ultrasound was very useful. Almost 93% of students reported that they plan on integrating ultrasound guidance into performing procedures in their future practice. In conclusion, medical students were more comfortable performing ultrasound-guided needle placement, thoracentesis, and paracentesis after a one-day hands-on training session on simulated models. Thank you so much for your attention. If you have any questions, please feel free to email me at the email listed here. And once again, I'd like to acknowledge that this research was made possible by funding from the National Foundation of Emergency Medicine Scholars and Mentors program.